Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Craniotomy for subdural hematoma. Introduction. A subdural hematoma is a collection of blood that is located outside the brain. This collection can be solid or liquid. Even though a subdural hematoma could be liquid, it is often referred to as a blood clot. It is a serious condition that can affect a variety of body functions and may also lead to death. Doctors may recommend surgery to treat a subdural hematoma, depending on the symptoms. If your doctor recommends surgery, the decision whether or not to have surgery is yours. This patient education tutorial will help you understand the benefits and risks of surgery to remove a subdural hematoma. The program first discusses the causes, symptoms, and the diagnosis of subdural hematomas. It then discusses the treatment options and the benefits and risks of the recommended surgical treatment. Finally, the program discusses what to expect after the surgery. The brain. The brain is the control center of the body. It is inside of and protected by the skull. The brain is further protected by a thick layer of tissue known as the dura. The spinal cord connects the brain to the rest of the body. A subdural hematoma is a blood clot that is located outside the brain but inside the dura. This is why it is known as subdural or under the dura. The blood clot may interfere with the normal functioning of the brain. In severe cases, a blood clot outside of the brain can cause death. Causes and symptoms. A subdural hematoma or blood clot can be caused by head injury or trauma. The trauma can either be severe or very mild. In some cases, the cause of the subdural hematoma may not be found. Patients on blood thinners, such as Plavix, Coumadin, and aspirin, may be at a higher risk of developing such clots, even from mild head injury. Even though these hematomas are known as blood clots, their consistency can vary from jello-like to water-like. The consistency of a hematoma tends to change with time. Early on, a clot is jello-like, but as time goes on, it liquefies and can have the consistency of motor oil. At very late stages, it may have the consistency of water. Because the brain controls most bodily functions, the symptoms of a subdural hematoma can be very different depending on where the clot happens in the brain. Symptoms range from simple headaches and blindness to other symptoms including weakness, memory loss, personality changes, speech difficulties, and poor balance. Seizures may also be symptoms of a subdural hematoma. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. Subdural hematomas are usually diagnosed when a patient has neurological symptoms and either a CT scan or an MRI is done. Rarely, subdural hematomas can be found with no symptoms. This is more likely if the hematoma is small. Not only do CT scans and MRIs help physicians diagnose subdural hematomas, they are very good at helping determine how long the patient might have had it and whether or not the hematoma is of a jello consistency or a thinner liquid. Treatment options. In some cases, the neurosurgeon may choose to observe the patient and repeat a CT, as some hematomas may be absorbed by the body and disappear on their own. Surgery. Depending on how big and how watery a blood clot is, one of two operations may be done to take out a subdural hematoma. Both are done under either general or local anesthesia. Watery liquid clots can usually be taken out through 1 or 2 holes drilled in the skull. This is known as burr hole evacuation. Thicker clots that are gelatin-like may be taken out through a bigger opening in the skull. This is known as craniotomy evacuation. Before taking the hematoma out, the hair on the head is usually clipped. Then a skin incision is made. Holes are made in the skull and the dura is opened. If the hematoma is a thinner liquid, the blood is drained. In the case of a thicker hematoma, a bigger skin incision is done and a piece of bone is taken out. The dura is then opened and the clot is taken out. At the end of the operation, if a piece of skull has been taken out, it is usually replaced and the skin is closed. Before closing the skin, the surgeon may place a drain in the subdural space, or the space under the dura where the clot was. This drain is usually taken out a few days after the operation. Your doctor will tell you how long you are likely to stay in the hospital. This depends on several factors, such as your age and medical condition. Risks and complications. This operation is relatively safe. There are, however, several possible risks and complications. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attack, stroke, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Some of the risks are seen in any type of surgery. These include 1. Infection. 2. Bleeding. 3. Scar that may be painful or unsightly. Infections may be limited to the skin only, or they can be deep, involving the bone flap or the brain. Deep infections may require long-term antibiotics and possibly another operation. The blood vessels of the area surrounding the blood clot are fragile and may bleed a lot either during or after the operation. This may require another operation to remove the blood clot. A blood transfusion may be necessary. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Other risks and complications are related specifically to this surgery. These are also unlikely, however, it is important to know about them. These risks include, but are not limited to, stroke, paralysis, weakness, inability to understand or speak, blindness, personality changes, seizures, and death. These risks depend on the location and size of the hematoma. The bigger the clot is and the more symptoms a patient has at the time of diagnosis, the greater the risk. Subdural hematomas could also cause significant brain swelling that worsens in the first 3 to 7 days after the operation. This can make the symptoms worse or cause new ones. These symptoms tend to improve with time. After surgery. After the surgery, you will probably spend a day or two in the intensive care unit, ICU, depending on how well you are doing. The nurses in the intensive care unit will watch you carefully. They will check your neurological status repeatedly, as well as keep a close watch over your heart rate and blood pressure. You will be repeatedly asked to move your arms and legs. You will also be asked lots of questions to determine whether you are confused. If your condition gets worse, a CT scan of your head may be ordered to determine whether there is bleeding. Swelling may occur. Medications are available to treat swelling of the brain if it happens. Later, you may require physical therapy, occupational therapy, and other therapies to help your recovery. Whether or not you will be able to resume your usual activities depends on how well you are doing at the time of your follow-up visit to the doctor. Your doctor will tell you how long it will take before you are healed, and if and when you can go back to work. This depends on your age, type of work, and medical condition. It is very important to let all your doctors and healthcare providers know that you have or have had a subdural hematoma. This may affect any future use of blood thinners.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Thanks to advances in technology and anesthesia, operations for removing subdural hematomas have become much safer than before. Brain surgery can relieve a variety of serious symptoms. It can even be life-saving. Complications of subdural hematoma surgery are possible but not common. The level of risk depends on the kind, size, and location of the hematoma. Knowing about such complications may help you detect them and treat them early if they happen. Thank you for using Explain.